all to our meeting. Today we're going to be having a workshop and some very good presentations. But first, I'd like to read the call. Honorable members of City Council, in accordance with the Virginia Beach Code, Section 2.-21, Virginia Code 15.2-1413, and the city's Continuity of Government Ordinance, adopted on September 15, 2020, and Chapter 1289 of the 2020 Acts of the Assembly as amended, and by authority vested in me as the mayor of the city of Virginia Beach, I hereby call for a special meeting by electronic communication means of the Virginia Beach City Council on Tuesday, January 12th, 2021 at 3 p.m. This special meeting will be by electronic communication means, will be held virtually with city council members participating via video and audio conference. The purpose of this special meeting is to allow City Council to hold a regularly scheduled workshop regarding items listed in the published agenda. The City Council meeting will be streamed live on vbgov.com and Facebook Live and will be forwarded for rebroadcasting on Cable 19. Sincerely, Bobby Dyer. Okay, at this point, could we have the roll call, Madam Clerk?
Thank you, Mayor. Councilmember Abbott.
Present.
Councilmember Berlucci.
Present.
Councilmember Henley.
Present.
Councilmember Jones advised earlier today he would not be in attendance. Councilmember Moss.
Present.
Councilmember Rouse.
Present.
Councilmember Tower.
Present.
Councilmember Wilson. Councilmember Wilson.
Aye.
Councilmember Wooten. Vice Mayor Wood.
Present.
Mayor Dyer.
Present.
10-0.
Okay, at this time, I would ask our great city clerk, Amanda, to provide the structure, rules, and guidance.
Thank you, Mayor. Good afternoon, Mayor and members of City Council. This is Amanda Barnes, the City Clerk. Today's meeting is being conducted electronically and is allowed as described by Mayor Dyer during his reading of the call for special session. Also, please note the meeting is being recorded. To ensure this live electronic event is successful, please note the following meeting instructions must be followed. Speakers, presenters, please mute any additional devices you have in the room to avoid any unnecessary background noise and/or the possibility of echoing or reverberation. It is important that once recognized, please wait 2 to 3 seconds to begin your comments to ensure council hears your complete remarks. Please begin your comments by identifying yourself. Also, do not ask, "Can you hear me?" as only one feed is open at a time to minimize the echo or reverberation, and as such, you will be unable to hear a response. At the conclusion of each presentation, the mayor will open the floor for questions and comments. Council members will be recognized in order which they raise their virtual hand. It is important that council members hold their comments until recognized. Also, it's helpful for council members to ask all questions and end by stating that you will stand by for answers. This helps to ensure all questions are answered before I move to the next council member. Lastly, please lower your virtual hand at the conclusion of your remarks. Mayor and members of council, are there any questions about this process? If so, raise your virtual hand. Seeing none, Mayor, I'll turn the meeting back over to you. Thank you.
Oh, thank you. And we have a little change in the order to accommodate Dr. Lindsay's very, very hectic and demanding schedule. We're going to allow her to proceed first for the COVID mass vaccination update.
Dr. Lindsay, if you would pause 2 to 3 seconds before beginning your comments. Thank you.
Good afternoon. Thank you, Mr. Mayor and members of the City Council, for the opportunity to speak to you this afternoon. And thank you also for your flexibility flexibility in accommodating my schedule. I do want to go ahead and get started since I do have limited time today. I'd like to update you on where we are with our vaccination efforts for the community. And we'll start with the first slide here. Let's go to the next slide, please. And this one, I don't know if you can see the full slide. It is cut off from my view, but basically I wanted to describe for you or give you an overview of what the vaccination approval process was for priority groups. You, I'm sure, are aware that the ACIP at the federal level recommended prioritization groups for distribution of vaccine. That is a recommendation at the federal level. However, it's still up to states to determine whether or not they will follow this or follow some other format. Virginia has chosen to follow the recommendations so far of the ACIP with some modification that I'll speak to later. That said, once the recommendations are received from the federal level, we do have an internal process for review in Virginia, and that goes through an advisory committee that makes recommendations to a disaster medical advisory committee under the state's unified command system, which makes a final recommendation to the state regarding the prioritization. Virginia has chosen to break the basic priority groups down into subgroups in the event that vaccine is received in smaller amounts that is not sufficient to cover the entire priority group at one time. And that has come into play as we're planning here in Virginia today. The other thing that I want to point out from this slide is that we have two streams of vaccination supply coming in. One is coming directly to the state for distribution through the healthcare system. We also have supplies that are going directly through pharmacies, through a pharmacy agreement with the Centers for Disease Control. That vaccine is directly is reserved for vaccination in long-term care facilities. We're very fortunate to have that arrangement. These long-term care partnerships or pharmacy partnerships can actually go into the long-term care facilities and vaccinate residents and staff directly. That has started in Virginia, and they are actively scheduling in the Hampton Roads area and have started vaccinating in Virginia Beach. Next slide, please. And you may have seen this from the governor shared this breakdown of vaccine distribution as a basic overview. I just want to point out the different groups. It starts with the group 1A, which is focused on healthcare personnel and long-term care. Then 1B and 1C, which breaks out into essential workers, and then opening eventually to the general population. Next slide, please. I'm not sure if you're able to see the entire slide here. I am seeing part of a slide, but basically this is the breakdown at the level of 1A, and the focus here is on healthcare providers on one hand, and also long-term care. And what I wanted to point out here is you have two parallel streams of priority that are going at the same time. One essentially focuses on a priority group based on their occupation or their work. So in 1A, that group is healthcare providers. And then the right column that is in focus here on my screen is long-term care residents. So here we have priority groups based on the risk primarily of the individual. So we know that in Virginia and in much of the country, we have individuals who are elderly, and particularly those elderly who are also in congregate settings, who are experiencing the highest risk of morbidity and mortality from disease COVID-19. Therefore, they have been prioritized to the top as a very high-risk group that needs to be addressed early on. And of course, our healthcare workers being on the front line, addressing the needs of our community. We want them to be protected. We need these essential workers to be able to safely do their jobs and also be there for the rest of the population. Similar to being on an airplane, and if there's an emergency, they always tell you to put your mask on first before you help others so that you can safely help others. And so we have this scenario, again, of two parallel streams, one focused on workers and one focused on the individual risk. Next slide. Great. And here I'm moving into phase 1B, and phase 1B focuses on frontline essential workers and also, well, let me start with that group. It is further broken down into subgroups, but essentially here we're looking at individuals whose jobs represent essential functions in society to keep it running, focused on services that we need for our day-to-day living. These are individuals in this first group of 1B who are not able to work from home. They are on the front lines, and it is critical for society that they are able to continue to work. And as you go through this, it starts with police, fire, hazmat, corrections and homeless centers, then childcare and teachers and staff, food service and agriculture, manufacturing, grocery store workers, public transit workers, and mail carriers. In parallel to that, looking at those at high risk, we start with individuals who are 75 years of age and older, and also people living in certain settings such as correctional facilities, homeless shelters, and migrant labor camps. Next slide, please. And by the way, even though this is broken down into subgroups, again, we're focusing our planning on prioritizing as much as possible in that order, but we are addressing the entire group, and we may, as logistically, we need to move within any group within this priority group once we're serving that group. This is the second group of essential workers. These are less frontline workers, but they are also essential to our running of society. And here again, we see many services that may be part of our city, our state services, energy, waterworks, also housing construction. There's also food service, higher education falls into this group, public safety engineers, legal, which would include courts, and other public health workers. As a reminder, we have some public health workers who are frontline providing clinical services and also very actively engaged in our vaccine response program. But we have others that are not directly engaged in clinical services that may fall into these latter groups here. And then on the right side for the individual risk, the focus is on individuals aged 65 to 74, and also individuals who are at high risk due to medical conditions or some disability that places them at increased risk of severe complications from COVID-19. That from 16 to 60. We want to be as possible in order to ensure that no vaccine goes to waste. So we're actively reaching out to these groups. For the employer groups, we are working with a lot of employees, reaching out, inviting them to give us a list of employees so that we can schedule them and get them in for vaccine. Most of the services for these different groups is provided through what we call closed pods, meaning since there are specific groups that are being served at one time, we are scheduling those. Individuals are able to call us, or we are also will be standing up an online registration program in the very near future to get on our list, and they can then schedule appointments based on the open slots at their convenience, so that we have a way of getting individuals in who belong to a specific group, and also some assurance through that process that we are indeed getting people who belong to the priority groups that we are targeting at the time. Next slide. So in moving forward, this is a huge undertaking. We have a large numbers of individuals that belong to each group. And you may have noticed some of the estimates of group size that we have. For example, for fire, police, and hazmat in Virginia Beach, we estimate over 5,000 individuals, about 5,000, almost 5,800 individuals estimated to belong into that group alone. As we're beginning, particularly for the provider group 1A, the providers for that were focused solely on the healthcare, public health, and hospitals providing that service, as well as I mentioned, pharmacies providing vaccination to those in long-term care settings. As we move forward and the populations are expanding, we're looking to recruit more and more helpers in providing, in serving our population for our vaccination program. We are currently very fortunate in Virginia Beach that we have a very active medical reserve corps that has formed a large support for our efforts today. They were also very active in our testing program. And in addition to that, we have EMTs that have been very supportive and a very strong part of our vaccination program. Part of that one, those and the vaccinators that I mentioned were our starting point, and also served as our ability to kind of launch and ensure that our planning was in place properly before we opened it up to the larger vaccination group. Much of this may not be have been entirely visible to the public because these vaccinations have been serving specific groups, but as we are opening it up more and more and progressing through the phases, it will become more and more visible what areas are being served, and that there is a lot that is going on and has been going on in our vaccination program. That said, we will also be putting out information for the public as we move through the different phases so that individuals will know where we are and when they can seek an opportunity for vaccination when their priority group arises. At this time, anyone is free to reach out to us at the health department, and we are also actively taking information so that when we reach a specific group, we will be able to reach out to those individuals as well. But moving back to our provider base, we are looking at expanding beyond hospitals and MRC and EMS. In addition to the federal pharmacy partnerships, we are actively working to bring on other pharmacy partners. And eventually, we hope to bring on other private providers as well as community health clinics and any other group that may be able to support the vaccination program. That said, when we look at private providers and clinics, there are limitations in terms of the ability for very small provider groups to be able to effectively work with us at this time. These vaccines come in multi-dose vials, and there are very strict storage and handling requirements that must be followed, which may make it difficult, for example, for small praxis to manage a program such as this. Again, we don't want any vaccine to go to waste, but we also want to ensure that the vaccine that we use is viable. Every vaccine that is put in an arm must have been stored and handled properly to ensure that viability. We are actively working in supporting providers to help bring them online and to help us with this program, although that will be scaling up gradually as we're able to bring them through the process and ensure they're ready to support the program. In addition to that, I did want to mention the elderly population and those with medical high-risk needs. We are aware that there are social needs that we are working through to ensure that we can meet particular needs of these populations to ensure access to services. That is also relevant, I feel, for some of our low-income and minority populations where we see extreme, much higher, disproportionately higher morbidity and mortality from this disease. So all of these things will continue to be a part of our plans. In essence, the large part of our program will be large-scale events that we're steadily increasing in scale. However, we do know that we will also be branching off and doing some special types of services to meet these special needs. Next slide. And this is just a reminder of the serious nature of this disease and where we are now. This map depicts the level of activity across the state. We in Virginia Beach are experiencing substantial community level transmission, and we are in a surge and having tremendously high rates of disease activity. We are progressively or frequently exceeding or setting new records on a very frequent basis in terms of the number of cases that we're seeing a day. Next slide. And just to kind of show you a relative comparison, July, the summer, mid-July, with our previous surge, in comparison, as you see that peak in the middle of the slide, in terms of number of cases, we have eclipsed that now, and our trend is continuing upward. So we're seeing a significant climb in disease activity and burden. And a lot of this has been exacerbated by the holidays and individuals gathering and continuing to have personal separation, celebrations and gatherings that exceed the recommendations in terms of personal preventive measures to slow the spread of this virus. It is very serious, even though we do have a vaccine now available that we're working hard to get out to the community. It is critical that individuals continue to follow the recommended mitigation with masking and social distancing, staying at home when they're sick, and following these hand washing, avoiding crowds, following all of these measures, which have an additive effect to reducing transmission in our community. Next slide. Next slide, please. And so I wanted to end with this slide. This is a picture or a closed pod from today. Again, this is today addressing our 1A group, which we're getting close to wrapping up here. But you can see the scale of this. For the program today, we have 20 vaccination stations open along the periphery of the room. You can see individuals safely separated by at least 6 feet of distancing. We can move a large number of people through this facility, and we will be scaling up to larger and larger numbers of staff. I believe today we're estimating over 700 people receiving their vaccination. And I believe that is all that I have for you now, unless there are questions. I have a few minutes, but I apologize. I will need to move on shortly.
Okay, thank you, Dr. Lindsay. I guess a pressing question that many of us have is when we start seeing a consistent high flow of the vaccinations down here. And because obviously a lot of people, I guess a lot of folks in Hampton Roads didn't get, weren't part of the 1B list from what I understand. But how are we going to do about getting a significant supply of the vaccination available so we can get it out?
So, Mayor, that's a challenging question. I would say that our agency and the governor's office at the state level are working hard to work and communicate at the federal level to advocate for us getting a vaccine at higher and higher levels. We have not run into any significant difficulty at this point in getting the vaccine as we are expanding the volume of people that we're seeing. But I do realize that as we're progressing into that 1B stage and beyond, we are going to be dramatically increasing the populations that we're serving, and we hope to see some relief very soon.
Okay, thank you. Any other questions for Dr. Lindsay at this point?
Yes. First question will be from Vice Mayor Wood.
Dr. Lindsay, thank you very much for your presentation. I have two questions, and I'll stand by after I finish. The first question is digging down a little bit deeper into what the mayor was asking. I know we have the capacity to deliver significantly more vaccine than we're getting. And what I'd like to know is if you can give me an idea of how much vaccine is Virginia Beach getting, and is it ramping up? I'm speaking specifically about Virginia Beach, not the region. And then the second is we talk about 1A, 1B and everything. How is it determined that what 1B is when 1A is complete? Is that done on a local basis? So if Virginia Beach says, okay, we're done with 1A, we can transition to 1B, or how is that done? And I'll stand by for your response. Thank you.
All right, I'll try to address the second question first. The determination of when we move on to the next level is made at the local level with the approval of the state. We do have to indicate to the state that we are ready to move on, and get their approval. And once that happens, we will be putting that information out, making an announcement and moving forward. That said, as you can imagine, the resources vary from one community to another, as well as the number of, for example, in this case, providers that a given community has to address, and the ability for the healthcare system or the hospital system to help support that effort. So there will be variation in that from one community to another. A lot of what, particularly for this group, a lot of getting those providers in has to do with reaching out to practices that we know of, and also scheduling those who are also seeking us out. And as we look at our appointment slots and start to see a decline in or more open slots, then we'll know that we're substantially reaching those groups. We have estimates of the number of those groups, but we don't have any exact assurance of how many people will choose to take the vaccine. We're also planning to have a very large scale event in the very near future to make sure that we've reached everyone who wants to get in case they have not reached out to us, or we had not located those for perhaps smaller providers. So I guess the short answer would be, at the point that we see evidence that we have reached almost everyone in that group. And we are close to that at this point.
The next council member with questions will be Mrs. Wilson, and then after council member Wilson will be council member Tower.
Thank you, and I appreciate your report. I guess I have a couple of questions. One is, I would really like something more definitive as to when we have expectations of these different levels. And in Washington, D.C., they're already inoculating people that are 65 and older, and so they are well ahead, whereas our 65 and older is several tiers down. And then also, what are we doing about people with health conditions like cancer patients and those with respiratory problems and that are very high risk? Where do they fit into all of this? And so I would really like to have an idea too of what kind of timeline that people can have an expectation, because people really want to know, when can I get my shots? When can I do this? And I stand down. Thank you.
If you'd like to reply, please. Thank you.
Since you described the 65 and older, or 65 to 74, and individuals who may have high-risk medical conditions fall into the 1C group. The 1B would be the individuals who are 75 years of age and over. We are anticipating, for the second part of your question, we are anticipating proceeding into the 1B group soon, I would say within 1 to 2 weeks. And that just depends on how many more provider groups we sort of see next week and the following week.
The next question will be from Councilmember Tower, and after Mr. Tower will be Councilmember Henley. Mr. Tower, if you'd like to begin, thank you.
Thank you, Dr. Lindsay. I've got a number of questions. I'm going to try to keep them to 1B, category 1B. My understanding is that several cities, counties in Northern Virginia and several counties in Southwest Virginia are in 1B, and that no other counties in the rest of the state, including what looks to me like all of the counties that are and cities that are presently surging, are in 1B. And my first question is, I'm curious as to how it comes to be that those two districts were selected to be, why are they ahead of us, putting it bluntly. The second question I have about 1B is if other areas such as the two I just mentioned, Northern Virginia and Southwest Virginia, are in fact already in 1B, then they must have a plan for distribution to the people in 1B. And I have a hard time accepting the vagueness, frankly, of how we are going to make distribution in 1B when we have other areas of the state that are already distributing in 1B. They obviously have a plan. They're not distributing on a street corner. So I'm just confused really about why we are not further along in knowing what the next phase distribution plan will be. I think that's probably all I can ask you at this point. So I'll stand by. Thank you.
Dr. Lindsay?
I don't think that we are confused about the distribution plan. We are standing up a facility right now that will serve very large volumes of people, and we are progressively expanding the capacity in that facility. That said, in terms of some of what I spoke about is looking at ways to address special needs, and these are discussions that are going on all around the state in terms of in addition to the large scale events that we are doing at this point and expanding, we will be looking at having other events to try to address particular needs that may arise in unique populations. This is not a discussion that's just going on in Hampton Roads or Virginia Beach. These are discussions that we're having throughout the state as public health. That said, as I mentioned, different communities have different resources. We have some communities that do not have as large a provider base as we experienced in our area. Also, some healthcare systems have in some communities taken on a much larger share of the responsibility for helping vaccinate non-healthcare system providers. That has also helped get them through perhaps at a different rate as other communities. That said, just as we have large volumes of healthcare providers in our area, hospital systems also have very large numbers of providers in their healthcare system, so they're not as able to help support the efforts that we have been doing now. But we do have a handle on this, and I am confident that we're progressing through it very rapidly, and we are bringing that to a close. and we'll be moving on to 1B. I shouldn't say a close, because as we move to 1B and 1C, we will still be honoring any healthcare, any individuals that present late at a later time in the earlier group, priority groups that need service.
Councilmember Henley, and after Councilmember Henley, it'll be Councilmember Moss.
Well, with all due respect, I know the folks have been working very hard, but the vaccine has been out for a month, and the numbers of people in Virginia and Virginia Beach who have been vaccinated is extremely small, considering that we've had a month, and considering all of the resources that we do have for providing this vaccination and the eagerness that I keep hearing from people to get the shots. To say that we're going to get to 1B in 1 or 2 weeks is just not acceptable. When I hear of a neighbor on Knott's Island who had his shot last week, it's very hard to understand why we're not doing better. I know everybody's working hard. We keep hearing a lot of talk about how much working. We hear people having great opportunities, encouraging people to take the vaccine. Well, people want the vaccine. And I guess I don't have a question. I'm just saying, to me, we're not doing a very good job, and it's just not acceptable, particularly when we're in a surge that places us at the highest that we've been during the entire pandemic. So I think all the resources that Virginia Beach has should be pulled out, and this should be our top priority right now to get our folks vaccinated. That's what's going to get our economy back and the people back in restaurants and so forth, and our kids back in school. So I think our top priority needs to be getting people vaccinated, and whatever it takes, we need to do it. Thank you, and I'll stand down.
Councilmember Moss, and after Councilmember Moss, Councilmember Wood, your virtual hand is raised again. If you would like to make comments, just keep it up. Thank you.
Well, I'll just ditto Ms. Henley's remarks and everyone else and I think the governor probably knows that Florida, New York, and a lot of places, states are vaccinating people 65 and over as of today. So clearly there's something deficient in our logistical execution, and the governor and company need to fix it. But my question goes to, how are we tracking the vaccination that DOD is doing in the region, since that's a large part of our population, so that we can get an idea when combined with what we're doing on the civil government side and what they're doing on the military side, that the combining of those two aggregate numbers gives us an idea of when we can start bending this curve. And so far, no one's really talked about, that aspect of our community. And I'm just curious, I know they don't report individual numbers, but is the state getting aggregate numbers so we get an idea of how much of our population is really being done on the DOD side? And are they doing shipyard workers? And are they getting vaccines for those people, or those people fall under our essential worker category? I'm interested in that coordination.
Dr. Lindsay?
Councilman, I don't know the full answer to your question in terms of how those individuals are counted or whether or not they are included fully in the state counts, but I will get an answer for you.
Councilmember Wood, did you have additional questions?
Yes, I did. I wanted to, and I raised my virtual hand after I heard Mr. Tower, because he used a phrase that I thought was very, very appropriate here. It's the vagueness of the response here. And I completely agree with Mrs. Henley. And I need to impress on you, Dr. Lindsay, as representative of the state, that Virginia Beach has the ability to vaccinate people 24/7 if we need to. If you can get us the vaccine, we can get it done. We have people that can surge forward. We've done this on a number of things. Any crisis we've had, we've been able to do this. And I can't impress upon you enough how much I agree with what Ms. Henley said and what Mr. Tower said. You know, the fact that that small communities in the western part of the state are doing better than us just means we're not getting enough vaccine. And I think that we've got to get more vaccine here. We've got to get in the hands of the providers. You know, we can put resources to it. You know, we showed this during the initial COVID issue with the beach, opening the beaches. The fact that we put, you know, a significant amount of money in getting the beaches open. We can put that same amount of money into vaccinating people. It is a priority. Virginia Beach has the ability to do it, and I would just, and it's not a question, it's just a comment that you know, and I don't mean to throw it on you, but it's an abysmal rollout from my perspective, because we've got to get these people vaccinated, and we have the ability to step in and do this, whether it be through the Medical Reserve Corps, whether it be through our hundreds and hundreds of EMS volunteers, or partnering with local healthcare providers and putting money towards it. We can do this. So that's just my statement. Thank you.
Councilmember Wooten, and after Councilmember Wooten, Councilmember Wilson, if you still have a question, if you'll keep your virtual hand up, we'll recognize you next. Thank you.
Yes, and good afternoon, Dr. Lindsay. Now, what I have to say, I guess, is a statement. I'm also interested in finding out a response as well. But what I understand in talking to some local providers, they've shared with me that they need resources in terms of training, you know, how to train people to give the vaccination. They need additional resources and funding as well to ensure that that process takes place. So I'm just wondering, and just putting that comment out there, I think we just really need to make sure that our local providers, you know, all of them who have been that we're utilizing within our city, that they have the resources that they need to do the job. In my experience, it's not getting the job done. Oftentimes, it's having the resources and the wherewithal to take care of the process, or to walk that process out. So that's what I'm hearing from some local providers is the additional resources that they are in need of to execute the process. I do also know that same provider that I talk with mentioned to me that she reached out, I believe it was statewide, to get answers and to some questions she had. And she said she was kind of, I don't want to say shocked, but she was surprised that during her call, she was asked to volunteer. And so she said to me, you know, it sounds like, you know, they need help. It sounds like that there are more resources and, you know, bodies, resources that need to be provided in the effort. So I think my statement is, in essence, let's make sure, you know, and I understand that, you know, everyone is working to capacity and everyone knows the importance, but I just want to make sure that our local providers have all that they need to be successful in implementing this vaccination process. And that's strictly from the feedback that I directly received in my communication with some local providers.
Councilmember Wilson, did you have additional questions or comments?
Yes, I do.
Need to move on to my next.
You would just give us just a second. Ms. Wilson has an additional question or comment. Thank you.
I think we're all feeling really frustrated because we're ready, willing, and able to get this vaccine out, and we're getting very vague answers. Washington, D.C. is already vaccinating people 65 and older, and we don't even know when people are going to be vaccinated that are 65 and older, only at 75. I mean, we're not getting these answers. And what's going to be the communication tool of letting people know when to sign up, where to sign up, where to go? I have not seen a communications plan at all. I mean, how do people know who to call? You know, where do they go to sign up online? I'm a council member and I don't even really know. So I want to know how we're getting this information out and when we're going to be able to get this vaccine out. And it's just very, very vague. I'm really disappointed.
Dr. Lindsay?
I'm sorry, I'm way over time. I really appreciate the comments and questions. We'll get some answers to you. You know, I realize this is a very important program, but I do have another presentation I need to get to.
Thank you, Dr. Lindsay. If it's okay, I'll give you a call tomorrow. Okay. Okay, we're going to move on next to a city council briefing on the United Way of Southampton Roads COVID funding status update with Michelle Anderson.
Ms. Anderson, if you would just pause 2 to 3 seconds before beginning your comments. Thank you. Mr. Dehaney would like to say something first.
All right, Mr. Mayor, members of council, the United Way and its partners will provide you with an update on the VB Relief Program, which seeks to help our residents and small businesses navigate the negative impacts of the COVID-19 pandemic. At the end of the presentation, they're going to ask council for additional funds as the needs for this aid is greater than the funding currently allocated. I know this is of importance to council, so as mentioned in the Friday packet, staff has an ordinance in line with the United Way request to present to you for approval next week. Please let me know after this presentation, please let me know if I should hold off on working with the mayor and the vice mayor on getting this on the agenda at this time. Thanks. You can go ahead with Michelle, Amanda.
Thank you, Mr. Dehaney.
Ms. Anderson, if you would just pause 2 to 3 seconds before beginning your presentation. Thank you.
Hi, well, thank you. I'm not sure I really wanted to follow that presentation, but I will say that I have always been a proud resident of Virginia Beach, and I continue to be impressed with your service and so supportive of what you're doing. And well, I should introduce myself, Michelle Anderson, President and CEO of United Way and proud Virginia Beach resident. I am proud that what we can control in Virginia Beach, we do, and we do it, and I would give us an A+ for that. So thank you for pushing the vaccine, and thank you for supporting the Virginia Beach residents. We are, again, honored to be here today and honored to support Virginia Beach residents in all of our work. And thank you to Mayor, who we've done a couple radio presentations together, and to City Manager Patrick Duhaney, and congratulations on the new baby. And what was that else I was going to say? And just thank you again to the City Council for all of your support, and look forward to getting through this first phase of 2021 and then having our community thrive. Next slide, please. So we launched this, it seems like a year ago, but it was only November 13th. Our presentation to date, we've had over 27,000 pages viewed on the VB Relief org. 50% of the traffic is through a referral source, which demonstrates the effectiveness of the advertising. And it takes visitors an average of only 3 minutes to complete the form. So we heard what you said and made it simple and easy. Next slide. So our marketing launched on November 17th. It was recently covered in Inside Business. We taped an In the Know video segment for Virginia Beach TV. We had 2 paid emails, each to over 50,000 contacts. Our open rate of the first email was above industry standard of 10%. And we had the same success with the digital advertising campaign, which is currently running. Engagement and the click-through rates are again above industry averages. And I will mention that this normally was a 6-week process, 6 to 9, and we did this in a little under 2 weeks because we know how important it was to get this open. And I will say, when we presented to you, we were just starting to have the increase, but we have continued as the virus continues to spread, have since Thanksgiving had an uptick on the number of requests and needs that we're facing in the community. Next page. So here is the results of our referrals. So again, we mentioned we've had over 2,800 requests for assistance, referrals to partners, food bank, over 1,000 requests for food, workforce council, over 680 requests for job training. And then when you go down to the financial assistance, which we directly implemented, housing, we had over 1,000 requests, utilities, 1,300 requests, and that includes power and water, non-city, gas, sewage, non-city, and then phone and internet. Medical, 251 requests, and then childcare was 164 requests. LISC, who does the small business grants, had 414 eligible applicants for their small business grants. And then you can see the pie charts to your right of how this launched and what we have experienced through January 4th. I will note as we go to the next slide that almost 100% of the requests that we received, or 100% of the forms submitted, requested at least one category of financial assistance. So what that tells us is that small businesses are also struggling personally, and it also tells you that people that are wanting job training are also in need of financial assistance, which really makes sense. So if you look through the United Way portion of the financial assistance, we had over 1.8 million in financial assistance funds that have been obligated. Over 1.3 million is actually out of the door. The remaining amount is where we're waiting for confirmation, and that is mainly in the housing area, because we're working with so many different landlords, and each of those have to be individually verified. We are continuing to process requests and provide financial management, because as of December 1st, our funding that we had available was exhausted, or we knew the request would exhaust the funding. So on December 3rd, we closed that portion of the web form, so everything else was available, but we continued to case manage and refer people as best we could. And again, I will tell you that when we have done this before, we expected about 100 requests a day. The first 2 days that we opened this fund, we had over 600 folks either put in a request on a web form or call for support. So it was definitely needed. And the city manager did mention that at the end, we are going to do a request. What we do have in here is a summary request, but for the financial assistance part, we put a request in for an additional 6 million, which would allow us to provide financial assistance to another 6,000 approximately residents over the next 3 months. And that's based on what we were experiencing in November and December. And as you know, we're just continuing to have a lot of pressure on the health and human service industry, and January has just continued with the spike. So again, we are really supportive of getting the vaccine out, and I just want to offer, if there's anything that we can do to help, please don't hesitate to contact us. And I know we're going to take questions at the end, but we're trying to get you back on schedule. So I will, if we go to the next slide, I will introduce my colleague, Christine, who is going to discuss LISC and all of the great work they're doing. Christine, take it away.
Thank you, Michelle. And good afternoon, Mayor, members of council, and City Manager Dehaney. I am Christine Morris, the Executive Director of LISC Hampton Roads. And as Michelle said, our organization is administering the VB Relief Small Business Grant Program. Thank you for the opportunity to give you an update on our progress. We opened the application process on Monday, November 30th at 12:01 a.m. and we closed it at 11:59 p.m. on Friday, December 18th. The application was available in English, Spanish, and I'm going to mispronounce this, Tagalog. Prior to opening and throughout the next 3 weeks, we worked with multiple local organizations to get the word out about the grant opportunity. I want to thank the City of Virginia Beach staff, the United Way, the Hampton Roads Chamber of Commerce, Black Brand, the Hispanic Chamber, the Asian Business Association, Asian Indians of Hampton Roads, the Virginia Beach Minority Business Council, the Philippine Chamber of Commerce, and the Philippine Cultural Center of Virginia, and many others for distributing materials to their members about this opportunity. We received a total of 621 applications, 557 unique applications once duplicate applications were removed, and 414 applications met eligibility requirements. And those eligibility requirements included that businesses must be physically located in the City of Virginia Beach, must hold a City of Virginia Beach business license as of December 1st, 2020, must have an active status in the Virginia State Corporation Commission Clerk's Information System unless the business is organized as a single proprietor, which does not require registration at the State Corporation Commission. And also, each business owner was allowed only one application, even if they owned multiple businesses in Virginia Beach. We asked that they selected one of their businesses for application. Those 414 applications, 54% are minority-owned businesses, 60 are women-owned, and 26% are located in low, moderate income census tracts. On January 5th, we sent out notification to all applicants. To the 176 who each were selected to receive a $10,000 grant, we requested that they provide additional information. That process of information collection is now underway. The demographic statistics for those selected to receive a grant are minority-owned 63%, women-owned 68%, and in a low moderate income census tract, 29%. Those 238 eligible applicants that were not selected for a grant were notified as well. We anticipate the first grants will go out the week of January 18th. However, the timeline for grant distribution is dependent on the response time of grantees to accurately provide the additional information requested, which includes the completion of a W-9 form through an online system and electronic banking transfer information. We will verify the W-9 and electronic banking transfer information and then transfer the grant funds. To supply a $10,000 grant to each of the 238 eligible applicants not selected in this round would require an additional $2.4 million. Thank you for the opportunity to be part of the VB Relief Partnership, and I'll be happy to answer any questions you have at the end. Thank you.
I believe Mr. Avery is next to present.
Avery, and I am President and CEO of the Hampton Roads Workforce Council. Thank you for having me here today and allowing the Workforce Council to be part of this exciting effort and partnership. As you know, the Workforce Council has been tasked in the VB relief effort with workforce development training for displaced residents as a result of COVID. As of the end of December report, 680 individuals have requested employment assistance. Of that amount, 468 indicated an interest in job training. Workforce staff has reached out to each of these individuals at least once, many times twice, and to date, connections have been made with approximately 50% of those individuals. Staff continues to make all efforts possible to reach those that we have not successfully connected with yet. Of those that we have successfully connected with, some are looking for actual direct employment or need to take care of other issues, as were stated earlier, before they are ready to commit to a training opportunity, such as income support, food resources, or transportation. Others may need remedial services before they are ready for training. But my staff, the career developers that we have at the Virginia Career Work Center, are working very closely with each of these individuals to assist as we can and connecting them to the services we offer beyond just the Virginia Beach relief to help them be prepared to enter into training. As you can see on the slide, at the end of December, we had 41 already enrolled, successful enrollments into the program, which we were very happy with that progress, considering the holidays and December being the end of terms for many training programs. But I am happy to say, as of this morning, that number is already up to 67 in training, which is a 61% increase in less than 2 weeks. And we already have 116 individuals in the pipeline for possible training opportunities. Our training obligations have risen from this report of 425,000 to over 725,000, and we anticipate this continued growth pattern until funds are fully obligated. Credentials that are in process include certifications in healthcare, which represent about 60% of those training, which goes right back to the conversation that was happening during COVID discussion that Councilwoman Wooten mentioned around getting individuals trained to assist in this effort. But we're also training in logistics, information technology, manufacturing, and others with an average expected wage of completion of $33,400 and $42,500. Our first successful participants will be done with the program in 2 weeks, and we look forward to providing future success stories to council. As part of this effort, we have also initiated a number of partners to enhance the program. We are currently working with the hospitality industry to identify relevant training programs, and in some cases working with our educational partners to develop new training programs to train interested citizens. We have partnered with Centera Healthcare System and their School of Health Science to offer a new 16-week patient care technician program, many of which will be able to assist with those COVID response. And we are discussing with a number of Virginia Beach businesses about hosting on-the-job training opportunities for those who may not want to go to the classroom, but still are interested in training. We are also coordinating very closely with our VB relief partners. We have partnered with the food bank to promote the training opportunities by placing information in their food distributions, and we're doing a similar outreach effort through LISC in the coming weeks to target businesses to inform them of the on-the-job training opportunities. We are continuing to spread the word about the workforce resources associated with the program, including e-blasts to community groups and churches, media interviews, and Facebook ads. We are very excited about the progress to date and that we are seeing over the next few weeks, and we thank you for allowing us to be part of this exciting effort. Thank you.
Ms. Anderson, could you advise who is the next presenter?
It's Dr. Ruth Nichols Jones.
Ms. Nichols Jones, if you would like to, Dr. Jones, if you'd like to go ahead, thank you.
Good afternoon, Mayor Dyer, members of the City Council, and City Manager Duhaney. My name is Dr. Ruth Jones Nichols, and I am the President and CEO of the Food Bank of Southeastern Virginia and the Eastern Shore. As you know, the Food Bank was charged with the awesome responsibility of assisting Virginia Beach residents who were experiencing hunger and food insecurity. As you can see from this slide, there were over 1,000 individuals and families that requested assistance with food support via this partnership. That number is staggering, but it should not come as a surprise, given that before the pandemic, there were over 36,000 individuals in the city of Virginia Beach experiencing food insecurity. And now, because of the pandemic, we believe that there are over 51,000 individuals experiencing food insecurity in the city of Virginia Beach. We have over 40 feeding partners in Virginia Beach that are committed to addressing hunger and food insecurity, especially during the pandemic. But many of them have limited capacity to receive the bounty of healthy, nutritious food that we have available through the food bank. Under normal circumstances, that would not be good news. Fortunately, through the Virginia Beach Pandemic Relief Partnership funding, we've been able to make strategic investments for our feeding partners in Virginia Beach so that more residents in Virginia Beach can access healthy, nutritious food. And that is good news. Within the first 30 days of receiving funding, the Food Bank of Southeastern Virginia and the Eastern Shore mobilized and supported 4 of our traditional feeding partners and 2 non-traditional partners in Virginia Beach to help them expand their capacity towards serving over 1,750 Virginia Beach households. With the exception of 3% from our funding award, all of our funding to date has been used to purchase food, refrigeration equipment, and refrigerated vehicles for our partners and direct distribution programs. We have completed 73% of the planned capital expense purchases for Virginia Beach feeding partners and Virginia Beach direct distribution programs. We've increased the amount of food we can distribute in a month by 50%, largely by bringing in more fresh fruits and vegetables, lean meat and protein items, as well as dairy. With our non-traditional partners in particular, I'd like to tell you about one especially. The City of Virginia Beach Department of Human Services has agreed to collaborate with the Food Bank of Southeastern Virginia to offer every other month mobile pantries. We've established an agreement or MOU with DHS, and we had our first holiday drive-through distribution on December 22nd. On that date, we served 750 households. The line of cars started wrapping around Virginia Beach Boulevard beginning as early as 7 a.m. We started early and we had to end early because many more households came than what we anticipated. We're pleased to be able to continue our efforts with our traditional feeding partners as well as our non-traditional partners. We're also going to be launching some innovative programs, including the 757 Mobile Market in February for City of Virginia Beach residents. We've worked strategically to ensure that every dollar invested from the Virginia Beach Pandemic Relief Partnership funding will help our community through this challenging time. Together with our partners in Virginia Beach, we're ending hunger today and nourishing hope for tomorrow. For that, I offer a sincere word of gratitude. Thank you again for this tremendous opportunity, and I'm available to answer questions with my colleagues.
Councilmember Berlucci.
Well, good afternoon to all, and thank you for that wonderful presentation. And I just want to take this moment to thank each of you and your respective agencies and teams for the dedication and the hard work and the innovation that you employed to implement this wonderful partnership, which is, I think, a reflection of the creativity that exists within Virginia Beach, and the uniqueness of a program like this is something that we should all be very proud of. And I know I am, and I'm very grateful for everything that you all have done to ensure that this is successful. My question specifically, though, is for Ms. Morris as it relates to small business grants. And I'm wondering if, and I'll just say that the number of applications received and compared to the amount of funding available for awards represents the urgent need that small businesses in Virginia Beach have for relief at this time, even in spite of all the other relief opportunities that exist for businesses. And in fact, if we don't continue to support small businesses and all Virginia Beach small businesses, we're going to find ourselves in a situation where those businesses do not exist. And with them, of course, the jobs and the impact they have on our communities and neighborhoods could be lost forever. So it's really incumbent upon us to do everything that we can to find ways to continue to support them. And I'm wondering, Ms. Morris, if you could offer some further detail about how your team made decisions based on the fact that there were 14 applications that met the eligibility requirements, and you were able to award 117 grants. And so I'm wondering how you made those decisions. And I'll share that, for me, I think a lesson that I learned was that we were enthusiastic about creating this program and funding it. And I think it's really important that we're all on the same page about, in agreement about what the eligibility requirements are. And so that's something that I'd be interested in learning more about. I was able to find that, and it's very clear on your website. So I appreciate that that's easily accessible. But I think it was confusing at times for some businesses who applied. And it was also confusing because, and I'm sure you are in agreement, there are many wonderful businesses that really needed the support that weren't able to receive it. And so they're wondering, and so am I, how you made those decisions. And I think that would be really important if you don't mind answering that. But then I would also just like to state that, and maybe we'll hear from Mr. Duhaney in a moment about the request that he's working on, but it appears based on your presentation that an additional investment of $2.4 million would allow us to make grants to all eligible applicants, which I think would be wonderful. And I think we also should consider, based on the time frame of when the application closed on December 18th and where we sit today and where we will sit when those applications reopen, that there will be additional needs. So I think if we're considering additional funding, I think we should be looking at potentially opening up again with even more funding available for relief for these businesses. So I'd appreciate your response to all of that. Thank you.
Ms. Morrison.
Correct that we are seeing small business community, and that the rate of application and the amount of funds requested bear that out. In terms of how we selected the 176 grantees that we were able to provide funding to, we used a process that LISC has developed over its time in being involved in these grants. And that is that after we determine the eligibility based on the eligibility requirements, we simply assigned a random number to each of the eligible grants and then just pick them in that way. We did over-select for minority-owned, women-owned, and individual businesses in the lower moderate income. That really is the population that LISC historically serves. And so when you make a partnership with a LISC organization, that is one of the benefits that you're going to get, that we are going to concentrate very hard on serving that population. I hope that's helpful.
Councilmember Moss.
If I could, just a quick follow-up to that, would you say that you're in agreement that the additional $2.4 million would be adequate, or would you be in agreement with the notion that I advanced that it potentially should be more?
I think that the 2.4 will only provide grants for those who did submit an application. I think there are many who would have submitted an application. The timing of our open portal was during some of the busiest times for especially retailers, the Christmas rush. And so I do feel like there would be opportunity to provide more relief to more businesses if there were more funding available.
Councilmember Moss.
Well, first of all, I want to say all the organizations together exceeded my expectations, the speed with which they could act, which was always my belief that the NGOs could in fact deploy in a rapid fashion relief. I compliment all of council, and I still think we stand unique in the Hampton Roads area, maybe in the state, for using our CARE Act money, not for I would call everyday government, but to go out and meet the needs of the people it was designed for. To compliment you all in the council as a whole, I've received several calls from academics doing research in other parts of the state and in fact in North Carolina as well, asking about how we came to that decision. So I applaud you on that. I do recall in your briefing in December, they mentioned that it was like 12,000 something households in Virginia Beach fell between what you needed in income to really be not food insecure, that's a term, and where the SNAP program eligibility stopped. And that was like 12,000 households. I think that was something in the neighborhood of that. And I noticed here we're serving about 2,870 between the first category and the second. So I'm really curious, looking forward, what is that gap? Because no one in America should go hungry. Let's just be clear about that. No one should ever be lack of food in this country. So what is that real gap going forward between what we've done and what the real need is for people that are, in effect, going hungry? I'd be curious about that. I've asked some other questions and submitted them to Ron Williams, and I'll get those before next Friday, and that's fine. But I do think this is an exemplary demonstration of what NGOs can do. I applaud you for using randomness, but I do think, to Mike's point, if we made an increase allotment in that area, not saying that we would, that maybe that randomness wouldn't, in that extra increment, wouldn't be disproportionately overreaching to minority groups, but would be more evenly distributed. That might be a way of balancing that out, keeping the core program. But if we added money, because there's other people out there who don't fall in that area, but are just as needy. But I do like the random idea. I think that's a good way to go when you can't really pick. But to Mr. Duhaney's request, asking for direction, I certainly support it being on the agenda on Tuesday, since that's a request that he made. But I do look forward to getting answers to the other questions that I submitted, because I am interested in how much money of the money given actually went into the hands of recipients, what went into marketing, what went into overhead, and what went into capital expenditures. I would like to understand that. But thank you for all that you've done. I think the citizens are how they're trying to help out those who are most in need. Thank you very much, Mr. Mayor, and to all the people that delivered the goods. Thank you.
Ms. Anderson, would you like to respond?
Okay. I know I won't ask if you can hear me, but I hope it's not echoing on your end. To answer Mr. Moss's question, and also we can get you information on the food bank and the number of people that we have in our community that are not only in need of food, but we called it the ALICE, Asset Limited Income Constrained and Employed. So those people that are working but are not making ends meet, we can give you those increased numbers and then also give you some information on the number of people that are food insecure in Virginia Beach. But I did want to answer your question on the overhead, because I think that's really important. We have less than, and we can get you the hard numbers, but less than 10% of the funds went to overhead, and that is mostly staffing. So we had the backbone portion that we have not spent, the 250,000, which includes marketing, and we can send you that breakdown. But it's marketing, and then having caseworkers on the phones is where the majority of expense and overhead was incurred. But again, it's less than 10%. An overhead, an acceptable overhead is up to 25, but none of the partners on this call, we all thought we could keep that significantly lower. So really proud of this team and the backbone. And I agree with the comment too. We have also all been contacted about how this partnership came about, and we want to continue this into the future and use this as an example for how our community can come together and save time and resources. So again, appreciate that. And also Kevin Chatelier and his team have some of the overhead question information that you want. If it's not specific enough, please let us know and we'll get it back to you, but we have it in hard numbers also.
Councilmember Wilson.
Thank you so much for getting this out to people who are going to be needing it. And I hope that grant money gets out quickly now that they've been identified. And I think that's really great. So my question really is for our manager, Patrick, how much of the CARES Act money do we have left?
Councilmember Wilson, to the mayor and other members of council as well. I think we have a little, probably north of 26 to 27 million dollars remaining. But I could be wrong. We can get you more information, but I think it's about 25 to 27 million.
Ms. Wilson.
Thank you very much.
Sorry, I do see Jessica Abbott. Councilmember Abbott, if you'd pause 2 to 3 seconds before beginning, thank you.
Thank you, and I apologize if this isn't the appropriate place to ask this, but one of the questions, and I'm mentioning it because Councilwoman Wilson brought up the remaining funds of the CARES Act. One of the things that I'm concerned about, and I'm hearing a lot of feedback from a lot of families, is the need for finding childcare, being able to afford childcare, and the increased difficulty in availability of that childcare because most of the private childcare providers, and I'm presuming all of the ones that are maybe set up by various governments, are under the same guidelines in terms of how much capacity they can have, as well as I happened to talk to a church that provides childcare as one of their services, and one of the things they had mentioned to me was their PPP was running out, and because they were operating at such a substantial decrease in children participating in the childcare, they weren't going to be able to continue to do so because they can't make up the funds through tuition and their PPP is running out. So I'm wondering, do we have any flexibility to partner with some of our nonprofit organizations to try to alleviate that burden? Because I do really think that of the things that we talk about on a regular basis, childcare is kind of the sleeping giant, and I'm very worried about what's going to happen if the vaccines continue to be delayed, or we don't have enough of them to get out to the public. And there's there's enough families in our community that maybe their kids aren't school age. So whether the schools decide to go back next week or in the beginning of February, there's still that group of children who are not school age, and finding childcare for them is a big part of how we make sure our workforce gets back to work. And so I'm just wondering, have we thought about that? Is there any ideas for where we can assist? Can any of that CARES Act money be used for that? It's just something that I'm just very worried about. Thank you.
Ms. Anderson.
Thank you, Jessica. Agreed. Child care is expensive, up to $1,200 a month for 1 month of infant child care. And so people have to have this covered in order for them to go back to work. We saw a decrease in requests for child care, but we believe that's because as people were coming on, it was Thanksgiving and the numbers were starting to go up. So a lot of employers that were face-to-face were now going back to virtual, and those that were essential workers already had childcare, and a lot of people selected in-home childcare versus a center because of the concern over the spread. But we are finding, like the Virginia Beach school systems, that children are not big transmitters and they are not getting sick from COVID. So we do expect to see this increase, and that is under the part that United Way is funding. But again, as we see the numbers kick up, we'll be reporting back to you once a month, and we can get with the city manager on and his team. But right now we're working with Grow Smart for Virginia Beach, and then also Smart Beginnings, which has all of the child care providers throughout our region. And so we can do a push out to them that these funds are available and to encourage people that may be contacting them for childcare but concerned about costs. We also do a lot of sliding scale fee, so we can help cover the part that people can't to get people back to work. Also, we talked about partnering with Sean's group at Hampton Roads Workforce Training to offer to people that are going through training that one of the inhibitors is I can't go for job training because I can't afford childcare. So we're also partnering as we are also with food. So let's get people trained, let's get them back to work, let's surround you with what you need to be able to move forward. Because we really don't want to see this linger for multiple years. So I'm not sure if that answers all your questions, but we are, are ready to fund that child care when we start to see the requests go up for that. And we could do more marketing specifically under that if that's something that City Council wanted.
Councilmember Abbott, did you have additional questions or comments? If so, you can begin.
I do have one other question, and let me first say thank you so much. I'm very happy to hear that that was in the thought pattern and when you guys were crafting your outreach. I guess a specific follow up to that is my family is actually in one of these circumstances because my husband's a school teacher and he will most likely be going back in the option 1 group to teach. And because he's been at home with our children, the childcare situation hasn't been a very big deal. But one of the schools that my daughter was going to is the one that reached out to me and said that, when our PPP runs out, we will be shutting our program down. And they're servicing a community that I think they have roughly, 75 to 80 children in their program. And so then when their PPP runs out, there will be, an immediate 80-some children that are displaced, for lack of a better word, that don't have a child care program. Parents will be scrambling to find one. And so is there, in the format that you have it set up, is there a way to help subsidize the child care providers who just simply can't operate, financially at the half capacity that they've been put on by the state level? And I'm not sure what exactly their capacity regulation is, but I know that it's been significantly impacted, and for smaller areas that or for smaller like preschools and Mother's Day Out programs and church programs and even private childcare providers that all they do is daycare. I know that they were counting on that revenue that they can't count on anymore, but they're still they have the increased burden of maintaining, the cleanliness and the distancing and all of that. So I'm wondering, is there a way to help with that too, so that we don't see childcare providers having to close their doors?
One of the outreach that we did do through your staff at the City of Virginia Beach is through the Grow Smart, Barbara Lido, and she did outreach to all of her contacts in the early childhood education and childcare community. And we did receive substantial requests for support from that sector, and we were able to provide a number of grants to childcare providers. And so I think that they did hear that that message that this was available, and they did apply, and we were able to award a substantial number of grants to those providers.
Councilmember Abbott, did you have any additional questions? Your virtual hand is still raised.
Yeah, I'm sorry. So is if there was I'm sorry, I'm trying to collect my thoughts on how I can say this. So there were applicants in the childcare field that applied for grants, and I'm assuming there's not sufficient funds to do another round of that. But if additional funds were granted, that could be a potential option for smaller childcare providers that may need a little bit extra help to stay open. Correct?
That's correct. And I will say that we did restrict to for-profit businesses at the request of the city. Some of the providers are nonprofit, so if that is someplace that you'd like us to expand for childcare providers, we could also consider that.
Morris, if you could please not unmute yourself and allow us to do that. It will stop some of the echoing. Thank you. Councilmember Abbott, did you have any additional questions?
Amanda, I don't have any other questions.
Thank you. Any additional questions or comments from council members? Mayor, I don't see anyone's virtual hand raised. Thank you.
Okay, thank you very much. And Michelle, I just want to thank you for your efforts and that magnificent team, that ensemble of just 4 different organizations that have come together and have done remarkable work. And sometimes government can't do it all by themselves, but relying on folks like you, boy, you sure make life a lot better for a lot of people. And for this, we thank you. And yes, Michelle, let's do some more radio together. That'd be great. Okay, thank you. Now, Mr. Dehaney, you got a couple city manager briefings.
Mr. Mayor, members of council, at this time, the aquariums director will provide you with a briefing on the South Building renovation, as well as a summary of the operational needs for the building. The building is scheduled to open this spring.
Ms. Spinolis, if you'd like to begin, thank you.
Mr. Mayor, Mr. Vice Mayor, members of City Council, and Mr. Duhaney, thank you for the opportunity to share some exciting updates regarding the Virginia Aquarium's South Building construction progress and our planned reopening. Many of you may recall the Marsh Pavilion, the second smaller building at the Virginia Aquarium, and in simpler terms, the building with the otters. This building has been under renovation and expansion over the last 18 months. Today, I'm excited to share with you our progress and plans for reopening. So let me whet your appetite. Next slide. This building was first constructed in 1996, and 17 years later, after extensive public engagement and input from our guests, we were able to submit and gain approval of the renovation of the existing building and an expansion for a new veterinarian wing. This project's design was first placed in the 2013-2014 capital improvements budget, and then in subsequent CIPs for construction. The vet wing was extremely important, with 8,000 resident animals and over 350 stranded animals that our veterinarian manages on a daily basis. This provides for space to deliver examinations, surgeries, and checkups. Next slide. So this slide shows you the footprint of the former building. Note, this was just a little over 18,000 square feet. Next slide. This slide depicts the new footprint of the South Building. You will note we've increased in size by over 223%. And rest assured, the otters will return with a brand new engaging exhibit. So let me walk you through a few of our new exhibits. Next slide. One of the reasons we are no longer calling this building the Marsh Pavilion is because we've added many new animals from the ocean in addition to our marsh ambassadors. The first area a guest will experience is the brand new jelly gallery, with 7 areas of jellies that guests can immerse themselves into. We are so thrilled to even have a touch pool for guests to touch our moon jellies. Next slide. Our Superpowers Gallery takes the comic book theme and applies it to animals throughout the world. We highlight our animals' superpowers, whether it's camouflage, to shape-shifting, to producing electricity. Learn how these superheroes of the sea use their gifts to help keep a healthy balance in their ecosystem, ward off predators, obtain food, and even seek out a mate. One of our most incredible animals will be our giant Pacific octopus. With its intelligence, super strength, and ability to become invisible, the giant Pacific octopus will be one not to miss. But wait, there's more. Next slide. Be sure to check out our Venomous Villains exhibit and test your own superpowers with educational and fun interactive experiences. You will be even able to touch the animals that survive and thrive in powerful ocean waves at our surge and touch pools. Our new veterinarian wing on this slide shows the amazing new addition to the aquarium, which will allow our guests to catch a glimpse of the important work occurring in our new vet center and discover what it takes to provide exceptional veterinarian care to our marine animals of all kinds. Next slide. Our watershed. We hope that this area will inspire children and adults alike to discover the wonders of water and better understand the impact we have on waterways through hands-on, fun learning opportunities. Next slide. Our outdoor amphitheater will seat approximately 250 people for outdoor animal programs, and our otters will return with an outdoor and indoor viewing area and a new slide for children to parallel play with the otters. Next slide. As a reminder, this project totaled approximately $19.6 million from the city and $9.3 million from the nonprofit partner, the Virginia Aquarium Foundation. Construction is full speed ahead, and please let me share a quick 30-second video of our progress. So are you excited yet? I'd like to invite each of you for a hard hat tour. Councilman Tower and Councilman Berlucci have already experienced this exciting tour, and I'd like to extend the invitation to you, Mr. Mayor, Mr. Vice Mayor, and the rest of City Council. We hope to open this coming Memorial Day. In this regard, please let me share with you our needs. Next slide. In our 2020 operating budget, we placed 5 additional FTEs for this building's operation. If you will recall from slide 4, we expanded our building by 223%. Of course, with COVID, all the proposed new FTEs were cut from the overall city operating budget, and we did not receive these much needed FTEs in our current year's operating budget. In order to operate our renovated and new building, we will need 5 additional FTEs. Please note, we will cover these salaries with this year's salary savings. So let me please briefly share these positions. First, with the expansion of our technical exhibits, and to be exact, a 58% increase in our technical exhibits, we will need an additional exhibits technician 1. Second, with the addition of our touch pools and an outdoor watershed, we will add 2 new gallery educators. Third, our water quality lab. How exciting for our guests to now be able to view 1,500 water quality tests through our interactive water quality lab. This 7-day-a-week lab will also be a viewable exhibit. And finally, of course, adding a new vet wing will allow us to meet accreditation standards and better care for our animals. We will need additional staff to care for the expanded animal collection. So our new South building will be even more incredible with new aquariums, galleries, exhibits, and hands-on learning opportunities. Next slide. I look forward to seeing each of you on a construction tour and at the ribbon cutting this spring. Thank you.
Are there any questions or comments from council members? If so, you would raise your virtual hand. Thank you. Councilmember Berlucci.
Well, I just want to thank the team from the Virginia Aquarium for the presentation, but also, as she mentioned, for the tour that I received a couple of weeks ago. And as she extended the invitation to other council members, I just want to say that I would recommend and encourage my colleagues on council to take her up on that offer. It was a wonderful tour, and having the experience of walking through helps to illustrate and inform the requests you made here today. So I do hope that the members of council will take the opportunity to have that tour and meet with them. And then I hope she'll have us back once those aquariums are filled with animals. Thanks.
Councilmember Tower.
I would just second Councilman Berlucci's comments. Please take advantage of the tour. You won't regret it. It's a lot of fun, and it's especially fun, I think, to be able to see it now. When a lot is there, you can see, there's enough there, you can see what it's going to be, but the excitement of going to the opening will be even greater. This is a tremendous asset to our city, to our tourism business. Thank you, Cynthia, for all you do, and you've got your staff, hardworking group of people, hardworking group of volunteers. We're really blessed to have you, and thanks for your presentation today. Excellent as always.
Ms. Manolis.
Thank you. Any council member that would love a tour, please contact me. I'll be excited to do it. Our chair of our foundation, Sal DeBarro, usually joins me. And of course, I bring an educator with me as well. So we usually have fun, and I always learn something too. So I appreciate the two councilmen who have joined me, but I would love to see the rest of you out there. And I'll provide the hard hat and the vest and everything you need to take the tour.
Any additional questions or comments from council members? If you'd raise your virtual hand. Mr. Berlucci, just if you still have your hand up from the last comment, if you would just lower it. If not, I'll recognize you again. Thank you. Mayor, that's all the questions or comments.
Okay, Cynthia, I just want to thank you for doing a magnificent job. And the aquarium is by far one of the major attractions in this country. And once again, it helps make us a very, very desirous destination for everybody. And yes, I will take you up on your invitation to not only do the tour, but I am definitely looking forward to the ribbon cutting. Thank you all, and continued success. Okay. And Mr. Dehaney, I think we got one more.
Mr. Mayor, the last presentation is going to be provided by Deborah Bryan, Acting Legislative Affairs Liaison. She will update you on your legislative agenda and other pertinent information regarding the General Assembly session, which will begin tomorrow.
Ms. Bryan, if you'd like to begin, thank you.
Good afternoon, Mayor, members of City Council, City Manager Dehaney, and City Attorney Stiles. My name is Deborah Bryan, as Mr. Dehaney said, and I'll be the Acting Legislative Affairs Liaison for this year's General Assembly session. The session starts tomorrow. Next slide, please. I wanted to first give you some key dates as the session starts tomorrow. The ones with check marks are already through. We've got our submitted redrafts, all of the corrections, all the pre-filed bills. Some of the House budget amendments have already been put in. And as of today at noon, all of the pre-filed bills were to be available. And tomorrow, everything will be introduced at 10 a.m. So needless to say, it's been a scramble time. Tomorrow, we will begin with starting at noon. And then next Friday, or this Friday, will actually be the deadline for the Senate budget amendments. We are anticipating that crossover will be on January 26th. And we are anticipating that the end of this session will be on February 11th. It is a 30-day session, which in an odd year has traditionally been extended to 45 days. But because this session is going to be a little bit different, it's going to be mainly virtual. And a lot of the committee meetings and testimony will be virtual due to COVID. It remains to be seen how this will be, but will be at least until February 11th. Next slide, please. So in this session, the senators have only been allowed 12 bills to patron and delegates 7, basically because it is a short session and normally there's somewhere around 3,000 pieces of legislation and it's 30 days to get through. So our delegation that is listed here, and I'll go through the bills, but Senator Lewis has agreed to patron 1 bill. Delegate Converse Fowler has 2 of our bills. And Delegate Guy has 3, and Delegate Askew has 1. Next slide, please. So in accordance with your legislative agenda this year, there were several items that were Virginia Code amendments that were requested by council. Vice Mayor Wood had requested the heart disease presumption for EMS, and that bill is going to be House Bill 1818. It's already been filed. Delegate Heretic had a similar bill. So Delegate Converse Fowler, which agreed to patron it for us, they have agreed to talk about it and co-patron into 1 bill. This bill would add full-time EMTs to the list of emergency workers that we would consider, heart disease as being presumed as an occupational disease that was suffered in the line of duty. We would like for them to make this a local option so that we would be able to pick and choose if we wanted our paid EMTs or volunteer EMTs to have it. At this time, we were requesting only our paid volunteers and only the presumption of heart disease. So we're trying to marry both Delegate Converse Fowler's and Delegate Heretic's together, and they're working on that. The next bill was also sponsored by Vice Mayor Wood, prescription drugs obtained by fraud. That is going to be House Bill 1860, and Delegate Nancy Guy is the patron. This would make it a Class 6 felony for any person to obtain or to attempt to obtain any drug, controlled substance, or marijuana over the internet, the U.S. Postal Service, or other commercial delivery providers without a prescription. The next bill, which was sponsored by Councilmember Henley, is Smart Scale Resiliency. Senator Lewis will be patroning that for us. And this adds resiliency as a scoring mechanism for the Smart Scale program for funding transportation projects. So for Virginia Beach, that would be a very good thing for us to be able to get those funds, because resiliency is something that is a council priority and something we've been working on. The next bill, the limitation on balloons, that was sponsored by Councilmember Tower. Delegate Guy is patroning that for us. That will prohibit deliberate outdoor release of balloons with a civil penalty of $25 per balloon release. The aquarium has done extensive amount of research and work on this. The balloons kill and injure wildlife, and we actually have this year a lot of support from other jurisdictions for this, and also there probably will be a few co-patrons for this bill as well. The small business definition, that was sponsored by Council members Wooten and Wilson. This is actually a key patron, or the main patron will be Delegate Lopez, and Delegate Converse Fowler on the behalf of the City of Virginia Beach will be co-patroning the bill. This will amend the definition of small business to 250 or fewer employees and annual gross receipts of $10 million or less. Right now it's or, and so by changing that to and, it will truly capture the small businesses. Stormwater supplemental fee was sponsored by Councilmember Moss. And as the city is exploring a possible bond referendum for flood mitigation, this bill would allow the city to assess a fee to all properties within the city equally, including exempt properties, to repay the debt. Currently that is in drafting, and there is not a particular sponsor for it yet, but hopefully by 10 a.m. tomorrow morning, someone will step up. As mentioned earlier, because of the limit of the number of bills, a lot of delegates and senators have been waiting to see if they have actually room for for the introduction. So we will identify those that still have room to do this, to try to get that introduced by tomorrow. The next bill is the alternate sources to fund mass transit, which was sponsored by Councilmember Tower. This is another one, as in the last one, that it has been drafted and it's ready to be filed. We're just trying to secure a patron. The recordation tax and transient occupancy tax is what's currently being used for this fund as of last year's legislation, and we are trying to find another way to fund the transit. Our delegate, one of our delegation, Senator DeSteff, has been working on this. He had proposed possibly utilizing part of the marijuana tax if marijuana bill goes through and is legalized. So they are working through that one. The next bill is the dome site, again by Councilmember Tower. This has already been filed as House Bill 1825 by Delegate Askew. And this is basically a technical amendment to the bond requirements, which would allow us to have this project done in phases instead of all at once. And the final one is the Tourism Authority, which the council just recently adopted. We put that in through Delegate Guy. It is House Bill 2043. The ordinance that this body passed on January 5th to establish a Virginia Beach Tourism Authority. Next slide, please. These are items that were also within your legislative agenda that were requested and all fall within budget amendments. The budget amendments will be coming further along. Both the House has already put forth their budget and the Senate hearing will be this Friday. And these will be worked on throughout the time of the General Assembly. The communications tax, we sent the delegation, the City Council resolution, and that is actually being worked on with a new member of our delegation and also several other people throughout the state. So to come up with a way for us to get the funds that were lost in the communication tax over the last few years as people started moving from landline phones to cellular phones and from cable TV to over the top. We've lost a great deal of tax money in that, and so has the rest of the localities in the Commonwealth. So we're working to find a solution to that. The second one is funding for the STEP VA program. Councilmember Berlucci had sponsored that. It is currently included in the state budget. We would like it to stay there. So the Senate Finance Committee and the House Appropriations and Finance Committee will receive letters from the Virginia Beach Human Rights Commission. They're writing a letter in support. The next one is the renovation of Building 2 funding. That was in the special session in 2020 and did not get passed. We're bringing that back. That is to appropriate $10 million. Restoring the K through 12 funding is currently included in the state budget. The council resolution is being distributed to the delegation, and we will be watching that closely as well to be sure that the funding stays in the budget. And then finally on those, Hampton University, Councilmember Wooten had sponsored this request. The current budget appropriation that is in the budget right now is for $571,750. But the Hampton University has their Proton Therapy Institute that has been doing really great things in research, and Senator Ward is going to patron a budget amendment to increase that to $10 million. Next slide, please. Diversity and judicial appointments. This was also an item on your legislative agenda, that the General Assembly give favorable consideration to judicial candidates who are exceptionally well qualified, but who also reflect the full diversity of the community they serve, especially candidates of color when filling any Virginia Beach court vacancy. We took your resolution, and also the Human Rights Commission is drafting a letter, and we'll send it to the chairs of the particular committees, and hopefully that will be taken up by them under consideration. Next slide, please. Okay, there are some additional items that came up after your legislative agenda that specifically we have been asked to bring these before you for consideration as to whether or not the council would take an official position on them to either support them or to at least give more information. The first one is House Bill 1738, and that comes from Delegate Wampler, who sent this to us, and he and Delegate Mugler will be patroning this bill. This bill would allow the city and any locality in Virginia to create up to 3 outdoor refreshment areas within the locality. Each one of these would be no more than a half square mile per area, and it would allow patrons to leave the business and walk around the outdoor refreshment area that's defined with their food and beverage, including alcohol. This is enabling legislation. It does not make outdoor refreshment areas anywhere. This would just allow the city, if it so chooses, to pass an ordinance creating up to 3 of these areas in the city. The second one is the body-worn camera system fund. Based on some of the information that we have received from our police department and also some of the recent briefings that we've had, this is a fund that is going to be created. It's a special non-reverting fund, and it will assist state or local law enforcement agencies with the costs of purchasing, operating, and maintaining body-worn camera systems. Also, the proposed budget includes an appropriation of $6.4 million in the first year from the general fund. And this is to make one-time grants to law enforcement agencies located in the Commonwealth that employ law enforcement officers with primary law enforcement duties. Interestingly, during the course of this briefing, I received an email from our police chief who received correspondence that they're actually have the application on the website, and they are asking for local law enforcement to give their interest and apply now, even though the legislation hasn't passed. Assuming that this is to show what kind of interest there would be. So this legislation, although it wasn't in your legislative agenda, could possibly be something that you would want to support, but we'll wait to hear that from you. The next one would be House Bill 1859, which was Delegate Guy's CPACE program. She brought this to our attention because she thought it was something that Virginia Beach Council should know about. These amendments to the program would allow the locality greater flexibility in administering the CPACE program, which is the Commercial Property Assessed Clean Energy Program. And this is a tool that can finance energy efficient and renewable energy improvements on commercial property. The last bill, as of just about an hour ago, now has a number. It's House Bill 2042. We're calling it the Tree Canopy Bill, also patroned by Delegate Guy. This bill relates to the replacement and conservation of trees during development. These amendments would allow localities to adopt local tree replacement and planting ordinances that exceed the previous minimum requirements to address things like recurrent flooding, to generate pollution reduction credits, or compliance with the locality's comprehensive plan, among others. Next slide, please. I include this slide for members of the public that may be watching. This is a public website where you can see all of the legislation that has been introduced. If members of the public would like to find out more about any of these proposed bills, please just go to this website, and then you will see on the first screen, bills and resolutions. If you click that, click all legislation, you can go to all of these bills and either read them in their entirety or find out more about them. And that's for your information. And if anybody has problems with that or would like this website, you can certainly go on our the city's website and find your the link to that as well. Okay, next slide, please. And again, I include this for the same reason for members of the public who may be watching. If you would like to find out who is your legislator in your area, you can just go to this website and you put in your address, Find Now, and it will give you the name of your legislator and how to get in contact with that person. Next, please. Okay, so as this will be a very fast-moving session, any items that the city has been asked to support or oppose or policy decisions will not be brought forward unless this council has already spoken on the matter, or once we come to you for direction, if you give us direction to do so. So at this point, I would be asking you for any of these bills, if there is any action you would like us to take as far as support or anything other than that. And then also any bills that come up during the session and how you would like for that to be done. We can certainly bring it to you as formal resolutions or in any way that you direct. Any other bills that we believe that would be of interest to the city or have an impact on the city, we have reached out to the various departments and just asked for information only, not position statements, just to see if they will impact the city in any way, and we would then bring that information on to you. Next slide, please. So I will stand by for questions.
Any questions?
Councilmember Tower, and then after Mr. Tower will be Councilmember Henley.
Thank you, Ms. Bryan. I really appreciate your taking on this task. You bit off a lot, and I hope you can chew it all. I want to just make one comment about the Tourism Authority bill. My colleague, Mr. Moss, has been transparent, as is his usual way, in indicating that he intended to oppose this. He was in opposition to the bill, to the resolution to support this, and he said not only did he vote against it, he indicated he would seek to have it defeated, notwithstanding the city's effort, which is his right to do, I suppose. But I just want to make sure, speaking of transparency, that we are entirely transparent about this bill and making it very clear to our legislators that the significant majority of this council supports that bill, and that we expect our on-site lobbyists to support it with vigor and to bring it home if at all possible. I'm not suggesting anybody wouldn't do that. I'm just making it clear that those are my expectations. I don't think I want to make sure there's no confusion about our support for that bill. You don't have to respond to that, Ms. Bryan, unless you want to, but I just wanted to let everybody know that's what's on my mind.
Councilmember Henley.
This is Barbara Henley. Yes, the tree canopy bill seems to be, from what I read briefly, contain provisions that we've been wanting for a very long time. So just my initial look at that bill, I think that's something that we want to support, and it certainly would comply with or conform to a lot of the research that we've been doing along those lines as far as the benefits of a tree canopy in flood reduction.
Ms. Bryan, would you like to reply?
Sorry, I'm muting and unmuting. So if you would like for us to prepare a resolution for next week, we can do that for you to formally adopt, if that is what the will of council is.
Ms. Bryan, if you will allow us to mute and unmute you, it will alleviate some of the issues. Ms. Henley, would you like to respond?
I would like to support that resolution.
Thank you. Councilmember Moss.
Well, first I'll respond to Councilman Towers' comments. I would hope and expect that our staff and our lobbyists would aggressively pursue all the bills which the majority of council has supported, because that's the council of the body decision. And I have reflected on my communications that a majority of our body does in fact support this request. As a matter of fact, I had a conference call with some state senators across the state this morning, and I did make that point to them when I had that conversation. But I will also aggressively, and I'll be transparent, express my views, and the public will be the judge. With regards to the CPACE thing, I would like someone, because there's a lot of little technical languages and some things of significance about what's not included in property. So I'd like to know the fiscal impact of those changes, of what was once taxable, but under this provision would not be. Because there's a lot of little technical nuance changes in that bill, and while you see the language, you don't get the operational effect of what that actually translates to. I'd like to understand it. I'm not opposed, but I'm not smart enough to know I should be supporting it. With regards to the tree canopy bill, I do support the idea of it, and I would like to certainly co-sponsor the assembly that resolution. I suspect others would as well. But it would like to be known if the staff could pick some sizable development that recently took place in the last 2 years, and how that would be different with the adoption of this bill. Because once again, you see it, and we realize we don't have a lot of development property that's just vacant to start, but also would apply to redevelopment possibly. I'm just trying to understand what is the expectation if we adopt it? What really is the potential, given what of our lands developed? What could we expect to achieve by it, so we don't set a false expectation with the public? And you don't get that from just reading the words. But a good example would be helpful from the staff that would illustrate what that would achieve, or how it would have been different if this bill had already been in effect. Thank you, Mr. Mayor. That's all the points I had.
Ms. Bryan, would you like to respond?
We will prepare a resolution for the tree canopy bill next week. And then also we will get you, Mr. Moss, the information that you requested about how it would be different and what the impact of CPACE would be on an example.
Any additional questions or comments? Councilmember Tower, I see your virtual hand still raised. If it's from your previous comments, if you would lower it, please. Councilmember Tower, did you have additional comment? Disregard. Councilmember Henley, do you have additional comments?
Yes, I think it goes without saying that I would be supportive of the body cam funding request. Thank you.
Thank you. Any additional questions or comments from Councilmember Wooten?
Yes, thank you. I just want to also note my support for the body cams legislation as well.
Any additional questions or comments from council members? Mayor, seeing no one having their virtual hand raised, I'll turn the meeting back over to you.
Okay, thank you. At this point, let me ask council members if anyone would have any objections to moving at least forward with the 4 items at hand. I guess, are we going to, Deborah, are we going to be talking about a resolution for each one, or do you look for a direction now to at least to proceed?
If council wishes to have all 4 of them on the resolution, I can do that.
Yeah, I guess see if there's any objections.
What's that?
See if there's any objections.
If there's no objections to that, we can certainly have the discussion next week, but if it's okay, if we can have each one at least ready to go and open for discussion, and I think that would be appropriate if that's okay. Does anybody have an objection to doing that?
If so, please raise your virtual hand to be recognized. Seeing none, Mayor.
Okay, we'll proceed accordingly. Ms. Bryan, thank you very much for stepping to the plate on this and doing an outstanding job. Okay, at this point, any council comments or discussions?
Councilmember Tower.
I just wanted to mention that the city clerk distributed to you today, and thank you for doing that, Amanda, a suggested ordinance to suspend local ABC license taxes for 2021 and to appropriate some money from the pandemic response fund to cover the costs, which are in the neighborhood that are called about $330,000 or $350,000. And I'm asking to put that on the agenda for your consideration for next week. Thank you.
Councilmember Moss, and then after Councilmember Moss, Ms. Wilson. Thank you.
I wanted to have just a brief discussion, Mr. Mayor and colleagues, on the city manager's letter on acceptance of funds for emergency rental assistance, not on the request itself, and I don't have any problems with what he plans on doing with that. But this has been an item I've mentioned before. We got to figure out how to get a different rule applied to Virginia Beach, because what happens on these programs, and it was on I think it was on page 2 of the 8 January letter. It talks about households that have a total income that are no more than 80% of the area median income. Well, our median income is higher than the area average, and our cost of rental apartments, our housing, is higher than the region's average. So this really makes it difficult for us to truly meet all the people in a relative sense who need assistance in our area, but yet we can't use federal funds to help some of these people because of the area median income. So I don't know, Mr. City Manager, what provision HUD has, or what's the process by which to go to get, there's always an exception to everything. It's always a question of who approves it and what do you have to go about to get it. But this is really reducing our flexibility, and it puts us at a disadvantage and puts our residents at a disadvantage for receiving federal assistance because we are an outlier from the region as a whole. So I would hope that we could, that's a longer term challenge. I realize, Mr. City Manager, but I think it's one we ought to spend some resources on, only because I don't see the housing situation. If you look at this cost of materials and see the change in already rising 10-year Treasury note and some other things, I don't see the gap closing between people's incomes and the rising price of housing in the near future for those people who fall below the median in Virginia Beach. So that's one point I wanted to make. Hope we could follow up on that in the future. Mr. Tower did touch up on one of the things that came up thanks to Mrs. Wilson's very astute question about how much was left that we hadn't obligated. I believe that was Mrs. Wilson, Councilman Wilson, who asked that question. I think Patrick said between 25 and 27 million. I guess we would need to subtract, Mr. City Manager, the 9 million that we're talking about. I think we leave 6 million. You can correct me if I have that. The starting number was the wrong one, the baseline. But I think we, rather than doing onesies, whether it's for tax expenditure relief or whether we decide, as I've mentioned to the mayor and vice mayor, accelerating buying body cameras and not waiting for the state because we have a big issue we're trying to solve locally. But I'd rather us have a discussion and make the commitment what we're going to do with the whole amount. And if we're going to reserve aside 5 or 10, great, so that we're not doing onesies, but we have done a comprehensive prioritization of the universe of things that council members think that remaining balance should be invested in. I would like to do that on a more comprehensive basis. I think we'd be best served by that. And maybe this will come up under council discussions. I thought maybe Councilwoman Henley might have mentioned it, but we haven't really talked a lot. I know about the tree canopy, but this is the issue about looking forward to building codes and other things that we want to do that are policy related, which tree canopy is one, that deal with the soft policy aspects of flood mitigation. I think that's important. And I mention that because in the material you shared, Mr. City Manager, with regards to the area that you're looking at to improve our permitting and planning review process, one of the areas that was mentioned where there was the greatest dissatisfaction was people's, our application of the model and the application and the number of reviews or changes at each review relative to stormwater mitigation. And looking for greater relaxation. Well, I would hope as we go down that road that if we are confident in our model and we're confident what it does and produces, and that's what you told us so far, we need to fix the process. We don't need to be relaxing on the performance requirements that the model says we need to meet to prevent flooding and to make our drainage system work better. So that's just my insight as I've read through those documents. That was the most concerning, but how many times it takes to get it right? We need to get it right the first time, but we really do need to make sure we're doing that model right. I also shared yesterday, the FCC issued a new ruling on rural broadband, which gives people who live in rural underserved areas the ability to put up their own antennas or towers for internet purposes. I don't understand all the details, but I've asked the staff to look at that to see if that applies to the southern part of our city. And if it does, I think that could go a long way to improving how we deal with that. And this is a longstanding question I've had, and if I've gotten the answer, I can't find it. But I had mentioned to the staff and our building, our new buildings, or in renovation of our buildings, and particularly the new City Hall building, are we actively installing ultraviolet light purification systems in our HVAC system? The best time to do that is at the front end. And I'm sure this won't be the last pandemic that we'll see in our lifetime or someone else's lifetime. And the time to put that kind of filtration or cleansing of your air system is when you're first building the building. So I hope that we are looking at that. And I hope there's a briefing in the near future going with the new building, whatnot, what are, might be at a future session, and it'd be a closed session, executive, about what our plan ahead is for security. I know Mrs. Henley has brought this up, but hopefully it'll be before the 27th of March or whatever we're going to get the budget. We'll know what we're going to be able to do. Maybe that's a CARE Act issue we talked about. But I do think that $26 million or 25, we got to have the, I'll call it the universal shopping list, so to speak, and then prioritize that list, let the public comment on it, and then adopt it so that make it easy for the city manager to know what our direction is. And those were the comments that I had for today. And thank you, Mr. Mayor. Thanks, my colleagues.
Thank you, John.
Councilmember Wilson.
Thank you. It's been a really good meeting, and I think we covered a lot of good ground. I just wanted to bring up something about the pharmacy committee that John Moss and I have been working on with some of the school board members. Because of the pandemic, a lot of the things that we wanted to accomplish and some of the site visits that we wanted to do, we have not been able to do. So we have been all in agreement, and I polled everyone to put it on hold for now and wait until things loosen up so that we can really give it our best shot of looking at it thoroughly. But I also have found a new member who is someone from the industry who will be part of our group, who will add a lot of expertise. He's a pharmacist, but he also ran about 30 pharmacies in the area. So that will give us some expertise when we do get started. So that's a really good thing. And this is something I wanted to mention to our good friend Preston Midget. I think most of us are aware that he's had a terrible, terrible time with the COVID, and he is now up at the University of Virginia Hospital, and he's being evaluated whether to get a lung transplant tomorrow. And it's really important, I think, for people to know up there what a valued person that he's been in our community and how much he's done for the citizens of Virginia Beach and how much he's added. and what a great volunteer he's been. And he's been a wonderful person, and and we've seen the Get Well Preston signs all over our city, and especially the resort, and that we're really all pulling for him. And we wish Preston and his family the very best. Thank you.
Mr. Tower, your virtual hand is still raised. If you have additional comments, you can go ahead and begin. If not, just lower your virtual hand, please.
Thank you, Madam Clerk. Just a couple of things. One, following up on Councilman Moss's comments about the onesie. I'm all for prioritizing. I think it's the right way to do it. I just wanted to get it into the stream to be considered. And this was really came at the suggestion of the Commissioner of the Revenue, and I thought perhaps there may be some timing issues with this tax that I wanted to make sure it was considered at the earliest possible date, but I'm not opposed to considering it along with other things. The second, I've been on the, have seen that it has come on the internet, actually, maybe since this meeting has started, because I sure didn't find it before the meeting. There is now on the VDH website, and I will share the URL, the link with all of you and the city manager and Julie Hill. There's now a link where you can answer a very brief, very easy to fill out questionnaire about who you are, what in terms of vaccine priority, and give your name and or phone number so that where you can be texted so that you can be notified by the Department of Health when your subgroup becomes eligible and the vaccine becomes available. This is what's already been happening in Northern Virginia, I know, because I went on and found that Alexandria was doing it itself for their 1B folks they could register essentially. And I think this will be helpful for folks that have anxiety about that they want to make sure that they don't miss the opportunity, that we want to distribute this and make sure it's widely known so that people can sign up. Now, I'm not, obviously, I'm not promising what will happen and how the follow-up will happen. I'm going on faith that the Department of Health will indeed follow up with folks if they do sign up, but at least gives people an opportunity to, one, understand where they fall in the priority, and two, to sign up to be notified by the Department of Health at the proper time. Thanks.
Any additional comments or questions by council members? If so, please raise your virtual hand. Mayor, seeing none.
Okay, thank you all, and I thought it was a very, productive and meaningful meeting. And I would also like to follow up on Council Lady Wilson's comment about Preston Midget. And this is a tough one for the family. It's a tough one for Virginia Beach. Preston Midget is a valued member of our community. He has worked hard in many regards, and especially with philanthropy and, serving on the RAC and serving on the Process Improvement Task Force, and just being a regular good man, a good family man. I received a phone call earlier today to ask for an indication of support from the council and or myself. And under an ideal situation, I would have come to council and asked for, a resolution signed by us. But given the immediacy of the situation, he is being evaluated by a 3-doctor panel, to qualify for the lung transplant, as soon as possible. And that being said, I was able to get a letter out today on an expedited basis. And, to the 3 doctors, it was faxed and being mailed. But once again, The value of Virginia Beach are the people that live here and work here and contribute to make us the greatest city. And certainly Mr. Midget is very much a part of the DNA of this city, and we wish him and his family and his friends well. And Rosemary is spot on. You go around the city and see get well and best wishes to Preston all over the city. But, you know, everybody, 453,000 plus in the city are valued. But, you know, right now, the Midget family needs prayers, and, you know, we're going to be with them. But I just wanted to inform the council that, you know, this action was taken, and we'll certainly keep you apprised of the situation. And that being said, thank you once again for a tremendous meeting, and we are adjourned.